Welcome back. The 2015 legislative session ended on March 14th, and out of that session, many healthcare-related bills were introduced. Some of those bills were passed and signed into law by Governor Tomlin and will affect how DHHR delivers our services to you. I'd also like to thank each member of the West Virginia Legislature for their hard work during the session. I have had the opportunity to meet with many lawmakers this year to discuss DHHR initiatives and look forward to continuing this partnership to improve the overall well-being of our citizens. I want to thank each of you who has made an effort to better our great state in some capacity, and I am very eager to see the successes that will result from new and continued collaborations in 2015. We're going to touch on some of the more significant bills that affect your health. Joining me now is Dr. Rahul Gupta. He is our Bureau for Public Health Commissioner and State Health Officer. Welcome, Dr. Gupta. Glad to have you here.
Thank you for having me, Madam Secretary.
One important bill that affects public health is the immunization bill, Senate Bill 286. Can you tell us a little bit more about that bill, Dr. Gupta?
Absolutely. There's a couple of things that this bill does to enhance and make sure that we continue to keep protected our kids that are going into school from infectious diseases. One, what it does is it centralizes the medical exemption process so that we can get people more efficient service in a timely manner. And secondly, it actually includes not only the kids who are entering school, but child daycare centers. So we are now going to be able to make sure that our rates for immunization coverage when kids are below the age of going to first grade, they're as well protected as they are when they enter school.
That's great. I know that this bill was a collaborative effort. I know that you and many people on your team, as well as some of our stakeholders out in the community, work very collaboratively with the Senate Health Committee. Can you talk a little bit about that collaboration and how that worked?
Absolutely. One of the things that happened is there were some reports of that rules were being affected inconsistently across the state, and we offered this solution. And it was a good partnership, but whenever there is a piece of legislation, you have to be careful because we do have one of the strongest laws in regards to immunization, and we're a model state in the nation. And it was very important to us that we maintain that stature.
Absolutely.
And therefore, we work very hard behind the scenes with our partners, with the community, with all facets, including leadership in the Senate and the House, to ensure that only the best and the strongest laws will be able to be passed and impact positively our people across the state.
And I think that's very important because, I mean, that's what we do in public health and in DHHR is protect our citizens. So it was very exciting to see that collaboration and commend you and your team on the work that you did. I know that some of the questions that the public will have, when will the changes be taking place? I know that currently the bill is waiting to be signed into law by Governor Tomlin. Once that occurs, can you tell us a little bit about the process and how the public will be educated on that bill's implementation?
Absolutely, Madam Secretary. One of the things about the particular bill is that when it does become law, we are going to be able to have that immunization officer who will be a licensed physician that will be able to make those decisions working side by side with community physicians. So this will be a colleague-to-colleague work in order to make sure we make the best science-based, evidence-based decisions for our children in our state, across the state. Secondly, that we will put in procedures for the exemption process that will basically be very much grounded in science and policy, and so we're able to, in a fair way, give those results out to children who are requesting their families exemption in a very sound scientific manner.
Now, would the public, at the point in which we're ready to implement changes, would the public be looking for these changes in terms of communication out through our website, or these are the types of things that we're in process, and that can we let the public know when that how that might happen?
Sure. Absolutely. Over the early summer and summer of 2015. We will make sure that the public is aware of the policy changes, physicians are aware, because we have nurse practitioners and physicians all over the state. We have what we call the Vaccine for Children providers, over 400 in the state. We have to make them aware, and so we will be making sure that this is available on the website, as well as much communication as we can do to make ensure that that happens. But one of the good things about that is also that we're going to be able to capture the data. One of the things we'll be assured to do is we will be knowing exactly how many people are applying for exemptions, how many people are getting the exemptions, as well as centralize the process in a way that it serves our people better across state.
Oh, that's great news, Dr. Gupta. Thank you for sharing that. I'd like to take a few minutes, if we have some time left, to talk about Senate Bill 335, the Opioid Antagonist Act. I know the governor has been very supportive of this bill. It's very important in our fight against substance abuse. Can you talk about that bill and really the significant implications that it has for the people of the state of West Virginia?
Absolutely. So there are drugs that can reverse when you are overdosed at home, because a lot of our rural communities, it takes more than 20-30 minutes for law enforcement as well as medical help to get to their home, then transport them back to the emergency room. And a lot of our people, we have over 400 deaths because of opioid overdose a year. These people, if they're given that timely drug, which reverses the effect, buys their time in order to survive and get to the hospital. That piece of legislation allows that to happen, so that family, friends, and others can keep that medication. Think about like an EpiPen for those people who may have anaphylactic reaction.
Right, absolutely. Makes sense.
Absolutely. So what happens is people are able to keep that with them in a responsible manner, and be able to, the friends and family is able to buy time for that individual so they can be transported to the nearest emergency room for help. And that is going to save lives.
And that, again, I think that's what we're all about, is saving lives. I think it's rather exciting to know that people can get a second chance.
Sure.
And I think in life we all deserve a second chance.
Absolutely.
And I think that's something that's important. Now, how will people be trained? That is the one thing that I've heard of many people question. What is the process for training for this?
So our Office of EMS, the Emergency Medical Services, has trained many of the EMS providers across the state already. What they're also going to be doing is launching a train-the-trainer type of activity, where we're going to be allowing and training a lot of people that will go further and train others. Through that, hopefully, many of the people can get trained. A lot of the naloxone type of medication, which are opioid antagonists, they are available. They need the training, but we're going to make sure when the physicians also are writing that prescription, they'll be able to give out the pamphlets and other information to those patients to be able to give them the educational that they will need to be able to administer that for their loved ones.
I think that's a very important point. I understand from much of the discussion that went on, the naloxone side effects are minimal compared to the benefit to the individual who is obviously going to overdose.
It's a relatively safe drug, and in addition to another part, which is the Good Samaritan law, it allows people to be not be prosecuted for that. I think we are going to be, as a state, having some of the best laws when it concerns opioid overdose in order to save lives and be really ahead in the nation.
It's great. I thank everyone for this work during the legislative session. I think it's obviously very critical to the people in the state of West Virginia, and two very, I think, important pieces of legislation that we're able to get through in our state. And again, we like to be known for our immunization rates and what we're doing in terms of dealing with the issue of substance abuse. So thank you so much.